Today we will be doing a progesterone level for our female Labradoodle. I'm going to kind of walk you through the steps. The first thing I want to do always is make sure my hands are clean. I just use a hand sanitizer gel. And the next thing I'm going to do, I like to put a glove on my left hand. I'm right-handed, so I put the glove on my left hand so that after I draw the blood, I can hold it to the insertion site with a cotton ball, and I don't get any blood on my hand. So that's why I've got the glove on my left hand there. The next thing I've got is a cotton ball. Once I draw the blood and I pop the tourniquet and pull out the syringe, I'll hold the cotton ball on the insertion site until I can make sure that there's no bleeding. Okay, so the next thing I've got here is my syringe. I've already attached my needle to it. It just twists to the top there. When I draw the blood or obtain the sample, I like to get at least 0.6 to 0.7 mLs of blood. That's what we consider to be a good sample. I've got some 70% rubbing alcohol. Once I've got my tourniquet on and I've located the vein that I want to obtain the specimen from, I will pour alcohol in that area and just to clean it, make sure it's good and clean before we get the sample. Okay, so this is Coco, our chocolate Labradoodle. I'm going to try to get a sample from her right front leg here. Let me get the tourniquet on. So you've got to put your tourniquet on kind of tight. Once you do, that cephalic vein will kind of pop up there. You can feel it. I've done this a lot, so I could kind of go by feel. Some dogs that are a lot hairier, they will require shaving that area, but again, I've done it so much that I kind of don't have to do that. You can see there I kind of just poured the alcohol in the area because I've located that vein. And the next thing I'm going to do is obtain that sample. I'm going to stick pull back. Then I take my cotton ball and place it very gently on that area. I take off my tourniquet and then I can kind of pull out the syringe. And then like I said, with my gloved hand, I'll hold that cotton ball on there until I can make sure that there's no bleeding.
All right, so after collection here, what we're going to do is we're going to take our blood sample and put it into our specimen vial here. So we're just going to slowly pour this in here, fill it full once we are complete there, and put this, close this tight, and we're going to spin the blood. Now you see in here we do kind of have something offsetting. It's just a tube full of water. We want to go to the opposite side of it here to kind of keep things in balance. We're going to spin this for about 10 minutes. Go ahead and get that started, and in the meantime we're going to go ahead and get started with this progesterone kit. All right, so after we get our blood in here and it's spinning, we're going to go ahead and prep and get ready for our test. So the things that we're going to need for this is our pipette transfer tips, 2 of those. Then we also have our detection buffer, our progesterone test, and then rapid test, and then the chip that goes along with this. So the key for this chip, the chip has to match the test, and then your buffers also come with a label, and they also have to match all the lot numbers. So everything's got to match or it's not going to run properly through the system. So we're going to show you how to do that. As soon as the blood starts spinning, we'll collect it and we'll get started with the test here. All right, so after I put my chip in, I like to read the chip ID, make sure everything's all set up. Go ahead and do that. Now the sample type is automatically on serum here. The pet type, we're going to put dog. You can select the dog, and then I go in here in the detailed information. So I've already pre-filled the animal's name. We're looking for Coco. She's a female. She's about 2.5 years old. And then the inspecting doctor, I put my name just for record keeping purposes. Go ahead and click yes. Now all that information will print out on the report for us as soon as the testing is done. All right, so it's been 10 minutes here since we started spinning this blood. Go ahead and turn this off and let it come to a complete stop before we open it. Once it comes to a complete stop, we're going to check our sample. and make sure that it's separated well enough. And as you can see, the plasma is here on the top with the blood on the bottom. So that is a good sample that we can draw from now. Okay, so after it is separated here, there's two positions on this pipette. So you push it down, you'll feel it stop. And then if you continue to press, it goes all the way down. We're only going to go to that first position when we pull out the serum from our blood sample here. So once we pull that out, it's going to go to that first notch that you can see in our pipette transfer. We're going to go ahead and take that and put this into our detection buffer. Okay. And after that, we're going to go ahead and remove that transfer tip, put on a new clean one. We're going to give this a couple shakes here, and then we're going to go ahead and mix this up with that other transfer tip and before we put it on our test. All right, so now that it's been shook up a little bit, we're going to go ahead and take our transfer tip here, insert it in, give it a couple more mixes as well. And once we feel like it's mixed pretty well, we're going to go ahead to that first stop again and then go ahead and put it on our test. So once we do that, it's completely on the test. Immediately go ahead and put this in here. Now, once you turn this on, you need to be at least in this 25 degrees area. If this is too cold, this 25 Celsius, if it's too cold, it will not run the test. Okay, so everything is on standard test. We're taking our test here, we're inserting it. It'll go until it stops, and then at that point we hit start test, automatic, and now our test is running. So it has started a countdown here. You can see 15 minutes and we'll have our progesterone levels. Now we have it set to print automatically. It'll also show up on our screen. So we'll check back 15 minutes. All right, our test is now complete. So this automatically spits out the numbers. And as you can see here, test result is a 10.62. This also comes out and prints. We discard this, and then we go ahead and turn it off and then take our chip out and put it back. All right, so here's the report here. So again, the info that we put in earlier, here's Coco, age 2. First time she's gonna be bred here. And again, you know, here's the time, testing time, did it. 10.62 NG. If you look up here, that's about a first day of breeding. I'm gonna go ahead and try to get her bred today.